Now that we're using the ComfortOR1 product, the smoothness and the transition from going from the preoperative area, which is pretty unthreatening in most cases, into the operating room has really improved, not only for the child, but for the parent. You know, we let the parents come back with the children when we, in most cases, when it's not an emergency, when we induce them to sleep. And that's a really high anxiety time for everybody, and there can be a lot of stress involved with it. And with the ComfortOR1 product, we're now able to kind of engage the child and the parent in that video environment that kind of really separates them from what's going on around them. They become less focused on the nurses and the doctors and the anesthetists and the things that are very scary for both the parent and the child, and more in the experience that the child's having in terms of the video they're watching, gradually going off to sleep. And it's really a much better situation. By having this kind of joint stimulus for both the child and the parent, it really is a much kinder way of putting them to sleep and allowing them to get ready, you know, for the next stage of the procedure. And that affects, I think, the operating room team too, because when we have to try and put a child to sleep who's very stressed, I think it stresses out the nurses, it stresses out the anesthetists, it stresses out the physicians. You know, my personal experience is to be there as a child's being induced and watch so that it's no longer a scary experience has really made a difference.